Hello YouTube, it is I, bandedwendy. How are you? It is Monday, the 28th of October, 10/28/13. Cheers. And I'm finding it hard to fit time in alone to be able to do these videos. So I'm here, it's probably loud. I'm in a parking lot of a grocery store, underground, Beverly Hills. Okay, so today is exactly 14 days away from my Body by Katzen. Last week I had, at the last Wednesday, I had an appointment for the dropping off my mammogram, since I had that done in March of last year, or earlier this year I should say, 2013. Getting my labs, blood work pulled and drawn and tested and approved. Having the EKG done, which I was told was fabulous. Blood pressure, just an overall general overview of my health, I guess. There's a name for it, but I forget what it's called right now. And getting the letter of surgical clearance. So I handled all that last week. And then today I got to meet with Dr. Katzen. So signed off on all the consent forms, which I had read a gazillion times at this point, for both the tummy tuck with muscle repair and the breast lift with breast augmentation. Got to talk to Dr. Katzen. Let's talk tummy tuck. Got to talk to Dr. Katzen about how small, I had my teeniest, tiniest pair of panties, where I would like to see the scar for the tummy tuck below that. Thumbs up on that. And then also for and I'll wake up in a binder, the kind that, you know, goes around, with Velcro around my midsection. And then about the breast lift and the breast augmentation, originally, you know, I was a 44 triple D. And when I went into this 2.5 years ago, for The Real Skinny, the TV show, I didn't even want implants. I just wanted a lift. And basically, a lift would do me no good. So it was do the lift and the augmentation or do nothing. And because of my mother's battle with breast cancer, I wasn't sure. And then throw on the top that I liked to be athletic, I wasn't sure. So I thought small, you know, C, perfect size boobs, right, in my mind, and pretty good for fitness. But, you know, I bought B bras, and my last bra that I bought at Victoria's Secret was a D, because they say they changed their sizes. So pretty much what I did over the course of the last week was give up the whole concept of how many cc's, what cup size do I want to be, and really waited till today to play with sizers without requesting a specific cc. Just like, you know, somebody asked, how many cc's are in your lap band? It doesn't matter. You know, it's your lap band, it's my lap band, our bodies are different. So, you know, the size of the breast implants is not just about a number I have in my head or a bra cup size I have in my head. It's about my height. I'm 5'10". It's about my weight, 140 something. It's about my breast width, depth, chest cavity, which I had a chest x-ray last week also. So I decided high profile. I want perfectly perky. Every time I talk about boobs, I want perfectly perky. So high profile, 400 cc. We'll see where that gets me. I tried on 350s. It turns out the three that I were in the range of 350, 400, 450 cc under the muscle. And he'll go around my areola. He thinks that'll probably be the only banale or donut incision. Thinks that I'll be the only one. He might have to go down the middle, and he might have to go under. TBD, to be determined while we're in surgery. No body effects. Oh, and so when I wake up with that, I'm just going to have a bandage around me. So that was pretty much what we talked about from a surgery perspective. He's excited. I'm excited. I brought a shirt that I normally wear in an extra small. I brought in a medium because I wanted, and it had buttons up the front. I wanted the implants, because I tried on the sizers, to fit with that shirt. I also brought a junior's large, which I usually wear a junior's small. Button-up denim shirt. Didn't have much give in it. I wanted to be able to button up that when I shop in the juniors department. And I brought a bathing suit top, a bikini top. Normally I wear a small bikini top. I bought a large bikini top. And it's really just the coverage, I think, that's different. Filled that up nicely with those 400 cc's. And then I brought my extra small tank tops. I mean, I have 3.5 years just about of clothes in the same size. So I really didn't want to give them up. So with these implants, I'll still be able to wear my extra small tank tops. So I'm happy. I don't have tits, you know. I cannot wait to see my flat stomach. I know there's a whole process from a recovery standpoint. That's where I want to be. The good, the bad, and the ugly, most of that happens during the recovery process. I'm ready to get there. The anticipation and excitement of it all, I'm done. Let's get into it. Let's do this thing. So 11/11/13, 6 a.m. I'll arrive to the facility. I'm sure there'll be more videos from me before then, but my pre-op appointment testing is done. My prescriptions that I needed for post-op, I had some of them changed to liquids because I'm a lap band patient. I will be keeping my lap band. I will be keeping my original port. The port will not move. The location, the skin, and everything will change, but the port location will not change. I am getting a slight refill in my lap band sometime in the next 2 weeks before surgery, just because I know my band too well, and I do not want to have any unnecessarily too tight restriction, which can happen, right? I don't want that. What else? Exciting! If I can get my thing to work, because it's not working right, because YouTube changed everything, I'll put some pictures in here. You know, Dr. Katzen, we talked about the incision line is going to be down here, and it will go to about right here. I don't need lipo. I'm not a lipo candidate because I have no fat left. Yay, really? Whatever's left doesn't need lipo. He will pull down and pull up and tighten up my muscles, and so it'll all be wonderful. I'm not doing 360, so I got some chunkiness right there, but I'm gonna live with it. And breasts are gonna be perky and full. So I feel really good about everything. I'm excited. I paid. Everything I need to pay with Dr. Katzen is paid for now. Here at the grocery store, protein and produce. I'm going to try my best not to eat any sugar over the next 2 weeks. I'd like to see the scale go down if possible. Lowest low would be okay by me. We'll see. Not sweating it. Fitness is on point. I can't drink my body effects. Anything with green tea, out of the question. Makes you bleed. He had someone who drank green tea, couldn't let them stop bleeding, found out they were drinking green tea. So he's got a rule, no green tea, and there's green tea leaf extract for my body effects. So is it in every other amino whatever drink out there. So I'm kind of screwed by that. So it's going to be organic fitness fuel by bandedwendy the next couple of weeks. So with that said, I'll leave it there. I have a lot of other stuff to update you on, but I'm good. Thanks for watching.